you want me to just call out everybody? Okay. Patty Adair, Rick Trelevin, Brad Porterfield, Dr. Gary Allen, Megan Haas, Dr. Shercliffe, Mike Shercliffe. Dustin Stillwell. Oh, sorry.
I don't mind. Dustin Zimmerman, I'm your innovator agent with the Oregon Health Authority.
This is awful. I'm sorry.
Yeah, Rick Russell, pastor of Mountain View Fellowship and Mountain View Community Development.
Carlos Ocelos, St. Charles Community Benefit. Chris Ogren, COIC.
Miguel Figueroa, Budget Management.
Gail Smith, Central Oregon Health Council.
Staff. You guys want to introduce yourself?
Rebecca Berry, Central Oregon Health Council. Taylor Arsenault, Central Oregon Health Council. Brenda Jones, Central Oregon Health Council. Kelly Adams, Central Oregon Health Council.
Okay, that's it. Go ahead, Tammy.
Okay. Thank you. It's a little difficult for those that are virtual to hear. So next would be public comment. Is there anyone in the room that would like to provide public comment, or anyone that's actually on virtually joining us as well? Okay. Don't really see anyone. So next would be, we have the consent agenda. So if there isn't any changes or edits to the agenda, if someone would like to make a motion, that would be great. And if someone is
Okay.
making it, oh,
There was a motion, Tammy, and a
okay,
second.
okay. Any further discussion? Okay, for all those in favor, or how about just anyone opposed? That's probably easiest. Okay. Seeing none, next we would go on to the redetermination update, and that is Trisha.
So let's talk about what redetermination is. It's likely that people are hearing this in different places in the community. So Medicaid redetermination is the process that states use to ensure Medicaid enrollees continue to be eligible for Medicaid coverage. Historically, Medicaid recipients in Oregon and in other states have had to reapply for Medicaid coverage every 12 months. This process ensures enrollees still meet eligibility requirements. The important note here is that redetermination was paused in March of 2020 due to the federal public health emergency, or PHE. So we have gaining membership without any check and eligibility since that time. The federal public health emergency was extended until October 13th, 2022. So I'm looking at the calendar. Is it the 13th today? The deadline to notify states that the public health emergency would be ending in October was August 14th. So there's a 60-day notice that happens. You okay? Oh, great. Looks like you can see what I see. All right, we're getting there. So it's a 60-day cycle to notify the states. In absence of such notice, we're assuming that the public health emergency will be extended on October 13th for an additional 90 days. So in the underlying date there, in all of those dates, the important one is we're anticipating this going until January 15th, 2023, and we should know in the next 24 hours if that's true. This means that redeterminations will likely not begin until 2023. Next slide. So I need to move this chat. There we go. Okay. So we're making some assumptions in this space. We have some information, but some of those, again, we are making the assumption that the public health emergency will end on January 15th. Redeterminations will take approximately 14 months from that point forward. So what happens is the second the public health emergency is ended, members will receive a notice from the state to begin eligibility questions to test whether or not they still meet eligibility for OHA. In that 14-month process, there are a couple of things that will happen. So OHA is going to stage re-enrollment by population types. The population types are on the right side of your screen. There are groups that they will front load. These are sort of the gimme groups, if you will, the ones that we anticipate will remain on the Oregon Health Plan. Then there will be backloaded groups. For example, currently in the works is a bridge plan. The bridge plan, so to qualify for Medicaid, you generally have to have an income of 138% or below the poverty line. It allows this opportunity for people who are 138% to 200% under the federal poverty line to be in what we call the churn population. So they are often the ones who are coming on and off of OHP. So there will be a bridge program created, but it's not in place yet. Sometime over the next 12 months, that's why people in a bridge program with higher degrees of income are being backloaded to that process, if you will. And then there will be about 1/12 of the population throughout the year in the groups listed below that will be spread out through the calendar year. We do expect to get some information relatively soon from OHA to help identify how many members are in these different groups, and then we will break that down by region in PacificSource, and we'll be able to provide some follow-up information. Next slide, please. This is really the same information as the last slide, but I know that there can be different learning styles. So I appreciate this, especially since we expect there's a moth in here. This is not a highly used room. Okay, back to it. Since the month 1 is likely to be January, as we look at month 10, then as you look across left to right in your screen, that would be October, the month we're in. And again, it talks a little bit about what groups will be front loaded in this process, what groups will be backloaded and then spread throughout. Next slide, please. And I think we get to what does this mean for Central Oregon, which is likely what you've all been asking yourselves. So August 2020 to enrollment, we were approximately 71,531 members. Central Oregon grew the most of all of the PacificSource CCOs, so of all 4 that PacificSource managed during the public health emergency at 36% in growth. We are continuing to grow month to month. So we are projecting in January 23, 73,000 members total. Then we're anticipating that disenrollment from Medicaid will begin April of 2023. So if you can recall, I said the public health emergency is likely to end in January. And then there is 3 months where the state will reach out to gather information from members to see if they still qualify for Medicaid or not. And if they do not, then we believe April would be the soonest we would start seeing members coming off of OHP in that space. Our projected loss, if you will, by the end of the year is to drop about 18%. We're estimating about half of each region's gain during the public health emergency will be lost for a total there of an estimated 60,000 members. So I really want to stress that we are really giving our best educated guesses in this space. We will continue to come forward as we start seeing trends. It'll likely be April, May, June. So as we look at those months, perhaps next July, we will start to have a better understanding for the numbers and how close we are in these estimates. And certainly as we receive any additional information, we'll be bringing that forth. But based on what we know now, that is our estimate. I'd love to pause for just a moment and see if anyone has any questions so far.
Carmen, is there anyone in the room that maybe has a question?
Any questions? You have to come back here.
It's good to have a sense of humor. Okay, great. Let's continue on to the next slide. So there is some really great news that should be celebrated in this phrase that recently came to light in what we call the 1115 waiver for Oregon. So first I want to talk a little bit about what the waiver is for anyone new in the room. So all Medicaid is both a state and a federal program, and states must apply for a Medicaid waiver when they would like to make a change that is different from the sort of normal federal guidelines, if you will. And you'll look at the next one at the date of the next bullet on September 28th. So this is really recent. We just heard news from the Centers for Medicaid and Medicaid Service. You will also hear this referred to in a healthcare landscape as CMMS. They provided the final decisions on what could go into the waiver. The waiver's intentions, which is really just incredible to be in a state that works and sees healthcare in this lens, but the intention is to advance OHA's goal of eliminating health inequities by 2030. So no shortage of lofty goals in that space. The next two bullets are going to be pathways to help us achieve that goal. Oregon will be the first state in the nation to have continuous enrollment for children through age 6. First state in the nation. This is groundbreaking work. So regardless of any changes in circumstances that would otherwise cause a loss in eligibility. Also in the new waiver, there will be a 2-year continuous enrollment for people age 6 and up. So often what happens with people who fall under 200% of the federal poverty line is 1 month they're at 136, then the next month they're at 98%, and they end up in this I'm on, I'm off, I'm on, I'm off. And how can we really improve the health of our communities when people are in fluctuation like that? So this will allow us to really dig in and do some incredible population health work to benefit the members in our community. So these are both really, really excited parts of our waiver going forward. I do want to note, this does not go into effect until redetermination is complete. So we don't want to start, the state did not want to start applying this until we got through this complicated process in the next 14 months. So just be aware, there may be some changes in some children rolling on or off in this space, and also adults, and know that this is the bright light that will be at the end of the tunnel as we work forward through redetermination. I think that is, I do want to share, and hopefully I think Camille or Carmen can send this out to the group, but the next slide, there's an active link. So if you or anyone in your organization would like to attend webinars to talk about redetermination and learn, this is one of the venues where we are learning as we go. But there are 3, only one has passed. There are 3 upcoming meetings, October 18th, November 15th, and December 13th. So certainly feel free to lean in and join there. Otherwise, I'm happy to continue bringing updates to this space. And just so you know, since there is such a financial impact to redeterminations, we're discussing redeterminations in the Finance Committee being led by Megan Haas as well. That's all I have for today. Does anyone have any questions?
Thank you, Trisha. Let's see. I don't see anyone virtual with a question. Anyone in the room? Okay. Oh, Megan, I'm sorry.
Megan has a question.
Okay.
Okay.
So I have to go into the
We're playing phone tree. So
coming right here.
Okay.
Where you going? Hi. So what I would be curious about from a health council perspective, is there some kind of organizing around helping patients that are going to be redetermined, help through the redetermination process, find different pathways to coverage if possible? That would be my curiosity.
Yeah, I think that's great to think about. That's, I think, exactly where we were hoping this conversation would go. I think we have a little work to do as a group in identifying where our eligibility people from the state are and how we can connect people who have questions in those space. I think I would love to ask who, and I would be happy to try to gather this information as well. So Pacific Source is not allowed to have eligibility or enrollment assisters because it would be considered a conflict of interest. But we would be happy to continue to redirect and ensure that all of us have these resources at our fingertips. I think the other important part of this redetermination is ensuring that we can reach our members who are on the plan. If I showed you our returned mail room at Pacific Source, it's significant, and we lobbied very, very hard and ultimately successfully to be able to access our members' phone and address. So we can make those changes. So if you are in an organization where people are saying my address is different, we used to redirect to the state. Now I would like to say that you can also redirect in all likelihood with live people answering the phones, come to Pacific Source, and we can update their address, and ensuring that we have points of contact is a really, really important part of this process.
I have a question that's related to what you just said, Trisha, and then Paul, I see your hand. How would I know if I'm not receiving mail from anyone? How would I know that I'm in the churn? How do I know that I'm either insured or not, and I need to let you know that my address has changed?
You know, the responsibility on the member is to notify every time they have an address change. As you can imagine, that doesn't often happen. I don't know how often we all in our rooms, in this room, do that, much less anyone who's struggling with housing or food security in those spaces. So I would just encourage, you know, as you're checking people in for different healthcare visits, that's a good opportunity. And I know a standard practice within a healthcare organization to say, is this still your address? If it is not, you can ask the member to please update that with Pacific Source or the state.
Excellent, thank you.
And specific to that churn, there's a real reason why it's pushed to the end of it's backloaded in the process, because we don't have the information yet. The plane is being built right now while we are speaking. So we don't really have information yet to pass on that. So as that plan gets developed over the probably next 6 to 8 months, then I think having conversations and helping ensure people what is that plan, what does that look like? It's likely to be you know, a place where people can either opt in at Pacific Source for continued coverage in that space. They would just simply, and Dan, I absolutely see you nodding, but shift into our commercial line of business in that space. But it'll be different than someone who is at 201% of the federal poverty line. So this is a unique and new program for our state, really.
Excellent. Mike, is your question in reference to what we were just talking about?
Yeah.
Okay, very good. Go ahead.
As you folks just recently read in the paper that there's a shortage of dental personnel, and I'm wondering what the plan is to make sure that all the providers who are out trying to get enough personnel to meet the demand, and when the impact of this, you know, you have 18,000 enrollees, go off, the impact that would have on the providers and their financial situation, given that they're trying to gear up to meet the demand, and then it's going to go away. My question would be, I know it's the enrollees are really important, but also the provider network could be pretty vulnerable to this. So I just think that I just put that question out there.
Any comments, Trisha, on what, or Carmen, on what, any plans for the provider network side?
I mean, I think that this is a good opportunity to take this to Operations Council and PEP and work through these issues operationally and have this presentation in those spaces. That's my initial thinking on how these types of issues could be problem solved.
Okay,
Yeah, we have been intermittently discussing this over the last year. It has been part of the director's report that is inside your consent agenda as a standing line item. Part of, I think, this communication hope is that these models are being built into financial planning for organizations going forward.
got it. Paul, dive in.
Yeah, the order of things where you listed out the number of new folks who came on during the crisis, and then the guess on how many will drop off. And then you mentioned the waiver. Will the waiver likely keep on folks who you thought might drop off? Was that number guessed after you got the waiver? Am I linking two things that really aren't connected?
Yeah, no, it's a great question. We actually had an internal meeting and I asked that exact same question yesterday during our Medicaid leadership meeting. That 60,000 estimate, which is about a 10,000 decrease over where we currently are, maybe 12,000, is not including the members that will then after redetermination be welcomed on in continuous status. So the 1 to 6 year olds, and then also the over 6-year-olds who will have 2 years of continuous enrollment. So we're hopeful more that is our stopping point, and then we will build up from there with the new things that the waiver brings to Oregon.
Excellent. Any other questions? Wonderful. Thank you as always, Trisha, and thank you,
Yeah.
Carmen. So I believe next we have Rick Russell joining us. So instead of a service story this month, I think we have an opportunity to hear from one of our providers who is serving our community. So Carmen, I'll turn it over to you.
Great, thank you. So I'm going to go ahead and introduce Rick. One of the reasons why I asked him to come today was because we're focused on so many things that are not working well. And so I think this would be a good opportunity to share all of the wonderful things that are going well with the funding that COHC is supporting. And this will move right into our housing discussion afterwards.
Yeah, thanks for the invitation to be here today. I do have a video, and I think I've seen it pop up. Can someone let me know if that will be playing? In just a minute, we'll play that. Yeah, thank you for that introduction. I'm Rick Russell, and I'm a pastor in Redmond at Mountain View Fellowship. And for a number of years, we've been engaged with our unhoused community. That began probably 7 or 8 years ago, hosting the winter shelter in partnership with Shepherd's House. We will be doing that again here November 15th. So it's getting very close. For 4 months, we'll host that, have about 20 to 30 individuals every night housed through the winter months in our gym facility. We've been engaged in a lot of networking, so working with our businesses in the industrial area, 17th Street, if you're in Redmond, where we have a lot of unmanaged camping going on, and it can be a rough element. And so working with businesses there and citizens there and service organizations to bring some collaboration, some cleanup efforts, some basic services like garbage service. And then we get into the more complex things we've done. About a year ago, we converted some space in our building to provide laundry and shower space to anyone in the community, but we especially find that there are a lot of unhoused folks taking advantage of that. And the Health Council provided, I believe that was a mini grant, and Rebecca Berry could maybe correct me if I'm wrong about that, to help purchase some of those laundry units. And so we have a volunteer team of maybe 15 or 20 folks at our church who I think 5 or 6 days a week now are at our church building, making appointments with folks to come in and do their laundry and take showers. And it's been a really helpful service. And then the most complex thing we do is safe parking. So we, for this, created a separate nonprofit entity called Mountain View Community Development. And I also serve as the executive director of that nonprofit entity. And we provide spaces for people to park who are living out of their vehicles. So cars, SUVs, RVs, with a case manager working toward stability. And we currently operate that at our facility, Mountain View Fellowship in Redmond, also at the VFW, and are actively working on several other locations that we hope to announce soon. One of those locations being a piece of county-owned property that you may have seen in the news just in the last couple of weeks. To give you a sense of who we serve and what we try to accomplish, we have a little 3-minute video here. And this is just from a few weeks ago. This is some footage from Central Oregon Daily, and they edited it down for their news piece, but we asked for their whole interview. It was 3 minutes long. And I've added the interviewer's questions just as a caption. And this is Kim, one of our participants who's new to the program. And this is what we do. So if that video can play.
Will and have been living in that. I'm a single mom and I haven't been able to find any place to live that's reasonable housing rates. And so when my ex and I split, I had to make a choice for my children and I. So we bought a fifth wheel and have been living in that since March.
And how'd you find out about the safe parking program? How'd you get involved?
My friend actually watched the news and saw them on the news. And so then I reached out to them. And I didn't have a place to put my fifth wheel. And I was being asked to leave the other place that I was at. So I needed a place that was safe for my daughter and I.
How long have you been here?
We've been here for about a month now. I think we've been working with the program.
And how's it going so far?
So far, I really enjoy it, and I've had a lot of good experience with them, so that I've actually told other people to utilize reaching out to them and their resources.
And what's kind of being done? What steps are being taken to kind of help you in the right direction to find more stable housing?
So we're making goals, and they have different organizations that they work with that they're able to help me find, because there's no like central place to find this information. And so then they meet with me and we've made goals, and we're working now towards getting me into a actual home and not in the fifth wheel.
Do you have any idea what would have been the situation if you couldn't be a part of the safe parking program?
Yeah, I was living in my car. On the weeks that I had my daughter, I'd go and stay with my friends and sleep on their couch. And during the weeks that I didn't have my daughter, I slept in my car. And when I needed a shower, I'd go to my friends' houses and utilize their showers. And
What was that like?
very difficult, very embarrassing, because you, as a full-time employee, you're expected to look a certain way, and you can't when you're living out of your car and washing with baby wipes half the time. So.
So the safe parking program is looking to expand. From what I just heard, sounds like right now 5 to 6 people are being helped or can be helped, but there's room for 40 people as far as funds go, with 25 people on the wait list. What do you just think of the safe parking program trying to expand or just expanding in general?
We need it. We need more people like them. We need people that see us as humans and that we're just in a tough situation and are willing to help. So I think it's a great program.
Anything else you want to say or add or think people should know?
If you're needing help, reach out. They're here.
Thank you. Kim was incredibly brave to do that interview. We were very hesitant to even ask her, and she's just been she's really wanted to share her story. There are a couple of things there that she shared. I hope you picked up on. We have funding to expand the program, and that's in large part because of the Health Council, the incentive matching funds. We approached the county commissioners. I know Commissioner Dare in the room, obviously. They were in unanimous support of funding this. And in fact, I think part of their motivation, at least I think for Commissioner DeBone in particular, the funding level they chose for us was based in large part because there were matching funds available through the Health Council. And so I really can't state how important this organization has been. And so with their funding level, it's given us about a 2.5-year runway to operate our program where we could house, we could provide spaces for up to 40 vehicles or 40 family units. And right now we are at 6 and on the verge here of maybe about 12, maybe in another month or two. And so for us, the bottleneck is locations, it's properties, and trying to recruit churches, businesses, service organizations, or using public land, city-owned land or county-owned land. And so we're actively working in those on those relationships right now. I know I'm brief, but I would welcome questions about what we do. All right, we must have hit it out of the park and explained it so perfectly.
Rick, thank you so much for what you're doing. And I think you've highlighted, whoop, does that mean there's a question in
We
the?
got a question from Chris.
Okay, great.
I
Hi,
just
Chris.
wanted to ask, hello, Chris Ogren here. I just wanted to ask, I've seen a lot of your successes in the media recently, but I've also seen and heard about not failures, but like roadblocks that have been put up. And I
Yes.
just want to know like how we're able to help support your efforts to continue to develop the program, and how you've been able to work past the roadblocks.
Yeah, thank you. Yeah, so we've had gotten a lot of media coverage, and I just regularly get calls from our local media asking for updates and where we're at. We took an especially difficult loss a month or two ago, working on a city-owned piece of property, and had followed some procedures, guidance of our council. There was a lot of strong neighbor pushback, and we went into that thinking we had a lot of political support, and then it turned out we did not. And that was some hard lessons learned for us there. We've also responded by increasing our, when we announce a new site, neighbor notification process. So for example, with a county-owned property, we mailed out 95 to 100 letters inviting landlords and tenants and homeowners to an informational meeting at our building and talking through that. Commissioner Adair was there with us for that meeting when we did that recently. We know that we're going to get resistance wherever we go, and we know that, but we try to mitigate it, and we try to show communities how it actually can make them a safer neighborhood, a safer business, a safer church. One way we're working with that, with the city on that right now, is working to establish no camping zones around safe parking sites, say within 500 feet or 1,000 feet, so that a lot of our businesses already have unhoused folks maybe around them. And by participating in safe parking, we can say, hey, we know who's in the program. There's a background check, they've been screened, they're working with a case manager towards something more stable. And then there is also with that an enforcement tool to for unauthorized camping to not happen there. And that's a big concern for neighbors is, if we invite, 3 RVs as a part of safe parking, what's to prevent 10 more from showing up? We think we have good tools for that, but we want to expand those anyways. And we're working really closely with our chief of police, our city folks as well. So Chris, does that answer your question, or can I expand?
Thank you.
Okay, thank you. Anything else? Yeah. I see a
Divya,
hand.
go right ahead.
Really great work. Thank you. One question I have is, there are multiple organizations that are kind of doing the same type of work. And I was just wondering, there's Reach and other organizations, how much collaboration are you guys having with them, kind of collectively doing this versus creating things kind of, not replicating or doing all the work alone?
Yeah, that's a great question. To my knowledge, the only other organization I'm aware of doing safe parking in Central Oregon is Reach, and Stacy Whitty, who does a phenomenal job. And she was very instrumental in getting us started last fall. In the spring, she stepped out of that role, and we stepped into it. And there's not a turf battle here, but it would be fair to say that Stacy and Reach are primarily focused on Bend, and we're primarily focused in Redmond. We do have communication between one another. We have shared clients, participants, and so we have very open communication. We also rely a lot on partners in other cities in Oregon, Salem, Medford, some other programs that have been operational for a few years. And there's really a great spirit of collaboration around, not reinventing the wheels on policies, procedures, things like that. Anything else?
Great, thanks.
Yeah.
Rick, I would just mention that you are doing incredible work, and the chat function of the virtual space, there's a lot of love being sent your direction and a lot of support. I think what Kim really highlighted for us is that we're serving individuals that are a part of our community. And I think it's easy to suggest that it's not happening for individuals that are from our community, that somehow it's, people from coming outside the area. And so would you please let Kim know that we appreciate the gift of her story and for sharing that with the community, because it's incredibly powerful. And she also highlighted, we have a lot of services that are out in the community, but when you're in crisis and when you're uncertain about where you're going to be sleeping, and particularly when you have children and you're worried about them, to navigate the system is, it's tough for those of us that have been in the system building it to know where to go for services. And so it's an important feature of what you've noted is that without supportive services, we can't anticipate that people will be successful. And so I wanted to say thank you very much to Kim, and please give her our best and appreciation for sharing.
Could I add just 2 quick notes about Kim?
Please.
Kim would want to say she was really bothered when that news report came out, and the reporter just slightly inaccurately suggested that she hadn't been working full time the entire time.
Yeah.
She was really bothered because she was very proud that she had been working full time through this entire ordeal. The second thing about Kim is that she's a single mom with shared custody. And we often get questions of, hey, if you can't afford it here, why don't you just move to somewhere where you can afford it? And we hear that question a lot when we engage with the public. And I would just lift up Kim's story of, where are you going to move that you can still have access to your daughter? And these are complicated stories, but they're worthy of our support. And so thank you for your time.
Absolutely. Yes. Thank you, Rick. Any other questions or thoughts? Okay, well, continue on. You've teed us up really well. Carmen, I'll turn it back over to you really quickly. It looks like we're setting up our next team, and through some texting from Carmen, it appears that we're going to hold off on the RIP update for this month and move on into who's on first for housing. Is that correct?
Yes, that's correct. And I think this just really, our previous person here, Rick Russell, really demonstrates why we do this work and all the work that's happening here in the region to collaborate. And there's definitely more room to make that happen. So I will pass this on to this whole housing team that's here in child program. Okay.
Hello, friends. So let me tee this up just a little bit. So a few months ago, as the Health Council, we wanted more information on the crisis that was happening in our community. What is the community doing to address the unhoused community members that are without support, and essentially who's on first? And we've heard a lot about, fortunately, the emergency task force that the city of Bend put forward and working to address immediate crisis in Bend. We had the turnkey projects that came online as well, Bethlehem Inn, the city of Bend being able to help on some of the housing crisis. And then we had a transition between Neighbor Impact and COIC in supporting HLC, which is our continuum of care. And then, drum roll please, we have Cheyenne joining us, the collaborative office, the partnership between Deschutes County and the cities. And so really an opportunity for us as the Health Council to get educated on who's on first when we're talking about addressing the unhoused crisis, and what can we anticipate in the future. And then what is the role of the Health Council for today? Primarily making sure that we know who's on first and who's doing what, and seeing if there are gaps associated. And Chris will be outlining a bit of what the future holds in terms of regional planning and being able to leverage and draw in additional funds. So with that, Chris, I'm going to turn it over to you and the team that's in the room with you.
Fantastic. Thank you so much, Tammy. I am.
You want the slides to go up now?
Yes, I'm requesting that the slides go up now, please. There we go.
Steve's here. There
Yep,
you go.
we're good. Beautiful, thank you. And there we go. Wonderful. Okay. So we're here today. I'm gonna do a little bit of introductions, and we're gonna be passing the computer along so folks can speak to each of their slides. But I just wanted to be here today. I'm Chris Ogren. I'm a housing coordinator with Central Oregon Intergovernmental Council, and I'm also the HLC, or Continuum of Care, liaison. Could we switch to the next slide, please? And I'm here today to introduce our partners in this work. I'm going to be passing the computer over to Lindsay Staling.
Hi, everyone. Thanks for having me. My name is Lindsay Staling. I am a program manager over at Mosaic Medical during the day, and I volunteer my time as vice chair for Homeless Leadership Coalition during the week.
Fantastic.
Apparently it's my turn. Glad to be here. I'm Molly Heiss. I'm the director of the Housing Stabilization Departments at Neighbor Impact. For those of you who haven't heard of us, we're the Regional Community Action Agency, formerly served as the Collaborative Applicant and Lead Agency and handed that baton to COIC most recently. We still retain the HMIS, or Homeless Management Information Systems Lead, and the Coordinated Entry System Lead.
And hi, I'm Scott Aycock, the Community Economic Development Director here at COIC. I'm, as is often the case, one of the least well-informed and least important people on this panel, but I will say a couple words about some background here for us. So if folks don't know, we are the region's Council of Governments as well as an economic development district. And our involvement in this issue goes back a little ways when we were preparing our update to the regional economic development strategy. And at that time, for the first time ever, heard that housing and primarily at the time was housing issues were the #1 priority in the region from an economic development perspective, which was new to us. And that was about around 2015 or so. Obviously, the issue has been fixed since then, so we're just moving on to, just kidding. So as we got involved with housing, that necessarily got us involved with houselessness issues. And so the conversations that, well, the kind of capacity and the stuff we're working on today goes back quite a few years. My first conversation with anybody with Homeless Leadership Coalition was Monica Desmond when she was serving as a contracted staff kind of planner person back in, I really don't remember when that was. It's been a while. And she laid out a vision for what our continuum of care could be, and some systematic and different kinds of improvements that we could make to capacity to fully realize it, make sure that it was all it could be. And that's a big part of what we're talking about today. Very proud that Chris introduced himself, is now serving as a staffer to support the Homeless Leadership Coalition and the Continuum. And we only hope to see many more good things coming down the road. So thanks, and that'll be it for me today.
Awesome. And could we go to the next slide, please? Perfect. Pass this off to Lindsay.
Hopefully you guys aren't getting seasick as we move this computer. So I want to describe what Homeless Leadership Coalition is and what it isn't. We serve as Central Oregon's Continuum of Care. It is a housing and urban development designated entity to serve and promote regional planning to prevent and end homelessness. It's also a collective impact model. Communities across the nation are organized into continuums of care in order to improve coordination, secure funding for programs in the homeless response system, improve data collection, and measure the performance of the entire system. We're not one organization or one nonprofit. We're really a membership network and a coalition. And here in Central Oregon, we serve the Tri-County area, and we like to include the Confederated Tribes and continue to ask for additional involvement and support so that we can really cooperate and understand that community members move through all of our communities pretty regularly. Next slide, please. So what does Homeless Leadership Coalition do as the Continuum of Care? We promote the community-wide commitment to employ best practice to prevent and end homelessness. We manage, implement, and oversee a coordinated entry system to reduce that problem that Kim was talking about, people not knowing where to go to get access to services. We've recently launched Built for Zero, which is a national movement to measurably and equitably end homelessness. And we launched that in 2022 after some fact finding and some technical assistance. We also secure funding annually. We bring about $800,000 to the region, and that's it from this particular effort that we use to fund, I don't know, 40 to 60 housing slots. We also administer the homeless management information system, do an annual point in time count of all the individuals who might be experiencing homelessness. It's a voluntary count. We'll talk more about that in a minute. And then we conduct the system planning that I know is so important for us all to work cooperatively together. Here in Central Oregon, we call it the High Desert Home. It's our 10-year plan to end homelessness. It was first written in 2011. It was later updated in 2015, and it's due for another update because the dynamics of our system have changed here in Central Oregon. Next slide, please. This is a visual representation. You'll see Neighbor Impact, our homeless management information system lead agency on the left. COIC is our collaborative applicant on the right. And then above that is a governing board of directors. It's 11 to 15 community members who represent stakeholders in the homeless response system. And that big circle is our general membership group. It represents education, healthcare, homeless services, social service providers, the criminal justice system, and the emergency response system. We have instituted membership dues recently to better sort of look at who is in and who is not in the homeless response system so that we can gather resources, seek input, et cetera. So we're really excited to formalize membership, but we also want to be inclusive. So those meetings remain open to the public, and we have a dues waiver process for those agencies or individuals who'd like to participate but have a financial limitation. The work of the continuum is really done at the committee level. So you'll see a number of our committees at the bottom of the screen, and that's where the experts, the service providers are really gathering and coordinating to assure that we meet the requirements that HUD sets forth for us and we can progress as a community. Next slide, please. And you'll see many of our partners, right? These are members of the homeless response system. They are members of Homeless Leadership Coalition. They represent our friends, our colleagues, our neighbors, and they're the people who are doing the good and hard work every day. And many of us as healthcare partners are referring our patients and our clients to these many service providers to get their most basic needs met. Next slide, please. And then I just like to talk that, you know, there's no one story. There's no one way to move from being unhoused to being housed. Community members will find themselves at kind of any point in this visual that you see here, all the way from literally unsheltered, which is a growing problem in Central Oregon with almost 80% of our homeless living unsheltered right now, all the way to folks who are living in community housing or affordable housing and bouncing back and forth, right? They fall on and off insurance, they have job changes, they have life crises, and that really dictates kind of where they fall in the path as well as who they turn to for support. So I think whenever we're talking about this issue, the social crisis, we really want to remember that there's not one story, nor is there one solution, and we can't do this work alone. I'm going to pass the computer to my friend Molly, so stay with us.
All right, me again. So next slide, please, I believe. So one of the responsibilities of the HMIS and Coordinated Entry Lead Agency is to facilitate the annual reporting that's required through the HARF Act, which is the regulation that governs the continuum of care programs. So across our systems, we collect data. We have a lot of providers that enter data into HMIS voluntarily. They're not required to do so by funding streams, but all of the continuum of care programs are required. So at best, our data is broad. Sometimes it's not as deep, but we report those system performance measures to HUD annually. We report longitudinal systems analysis. We report the point in time count number and the housing inventory chart. What you see here talks about the HUD system performance measures. So it looks at the participants in continuum of care programs and other programs that have entered data into the HMIS systems. And it looks at their state, basically. Are they in need of income and job growth? Have they had that successfully? Are we looking at a lower or an increased number of people experiencing homelessness for the first time? We're looking at the length of the episode that they've experienced. We're looking at their housing placements. And I can't see the remainder of this and don't have it memorized because it's not been my role for quite some time. But the long and the short of it is that we're trying to capture how our COC response system is having an impact on our unhoused population and moving them into a house situation. These performance measures are due annually to HUD. The Built for Zero initiative helps look at this in a different frame and on a more regular basis than annually. So we're super excited about the continued effort in building an active by name list, which tracks and makes us aware of the circumstances and situations of all of our people across Central Oregon. Ultimate goal there, sorry. Tracking and being aware of the situations and circumstances of anyone that's unhoused in Central Oregon. Next slide, please, I believe. Okay, so our purpose as the HMIS lead is to be the back-end support. We manage the HMIS licenses, we do new user trainings, agency agreements, we interact with Oregon Housing Community Services, who currently holds the small continuum of care across Oregon. They hold that implementation. So the larger counties have their own implementation. That's kind of a technical support issue there. We also offer end user support and new user training, et cetera. And then we also pull those annual reports on behalf of the COC and the monthly data that goes into the Built for Zero initiative reporting. Coordinated entry is also run through the HMIS system. So we facilitate that weekly meeting to case conference folks that have been assessed for vulnerability based on homelessness status. And then we case conference based on available openings in shelters and in COC housing programs. That's my wrap. I'm going to pass it to Chris. Thank you.
Next slide, please. So we've heard from the HLC co-chair, Lindsay, and we've heard from the coordinated entry and HMIS specialist and lead agency being Neighbor Impact. And now I'm here to talk about that right hand that was on that structure slide earlier. Sorry. So the collaborative applicant, the purpose is to provide professional support and guidance to the COC, particularly around COC-wide activities. So think about us as like the back office, backbone support that helps enable service providers to really do their best. And so only nonprofits or government agencies can serve in the collaborative applicant role. And we're responsible for several things. Submitting the consolidated application on behalf of the COC, and that is just like one line, but has consumed months of many of our lives. So if you're interested in that process, I'd be happy to talk about it ad nauseum, but I'm not going to waste our time with it here today. We're also responsible for facilitating the point in time count, for providing general COC administrative support. So things like hosting meetings, paying for websites and phone bills and software subscriptions, helping provide note-taking and web updating, things like that. We're also responsible for the publishing and maintenance of the region's 10-year plan to end homelessness, which Lindsay had indicated is due for an update. And we agree. And then we're also responsible for ad hoc needs that come up as things change and the world that we operate in shifts. We're responsible for kind of remaining flexible and adapting to the need. Next slide, please. So I'm going to speak specifically about a couple of these responsibilities in more detail, just to convey maybe the importance of them. So the point in time count specifically is an annual survey of homeless individuals in the United States. And it's really a combination of effort from all organizations in the region to work together to try to count all people experiencing homelessness in Central Oregon. That occurs on a single night in January, and you can assume the challenges that our service providers face when they're trekking around the Tri-County area in the dead of winter really trying to find out where folks are located. So some progress that we've mentioned, Built for Zero and absorbing the by name list and getting that integrated in the community. There's a goal there that eventually we'll have data that is as of a high enough quality that it can replace this point in time count. And we can actually have a better understanding of what our homeless population looks like over the span of the year versus on one night. And so to be clear, this is a massive coordination effort between service providers, outreach teams, shelter providers, local governments, and nonprofits to ensure that the number that we have on that one night in January is as accurate and comprehensive as it can be, because there's a direct link between the amount of folks that are counted that night and the amount of funding that comes to the region for the upcoming year. So it's very imperative that we count as many folks as we can and have as accurate of a sense of the houseless population in our community as possible. Next slide, please. And then the 10-year plan to end homelessness. So this is really our region's roadmap or coordinated effort to solve houselessness in the community. And that is to say that there is not one group that is going to end this. There is not one group that is going to be able to house every person that needs it and also provide the services that they need to remain successful in that. And so that's why we recognize that this is very much a regional partnership. The goal of the 10-year plan is really to align incentives and best practices and ensure that everybody has the knowledge and the tools to carry out the needs of the community, and to create a plan and identify the responsible parties to impact change so that folks actually have a vested interest in the goals that we want to see in the community. We also really want to see best practices truly embedded in regional strategic planning efforts. So finding things that the houseless service providers agree are all best practices, and then embedding those into things like funding opportunities that are available locally, things like maybe the regional health improvement plan or regional health assessment might be some opportunities to intersect. And it also creates an opportunity for us to proactively plan for ways to end houselessness or positively impact it, rather than just reacting to things as they come up. Okay, and next slide, please. So I just want to kind of put a bow on this. And if I want to give you one thing to take away, it's really this sense of the better that we support the continuum as a region, the more resources we're able to bring, the more services we're able to provide, and the more individuals we're able to serve. And one more slide, please. So where we are today and how the Central Oregon Health Council can help. There's a few ways. I would say first is awareness, just a general awareness that this system is fragile, and there are a lot of folks that are working really hard to ensure that it operates efficiently and effectively. But there's also a sense that if we don't maintain the system or it becomes fragmented, then what would happen is our continuum of care would go into what's called the balance of state, which means that we're looped in with like 18 or more additional rural counties, which would mean that our local control of how we use the funding that HUD gives us would now be competing with nearly 20 other entities. So it's really important that if we want to keep local control, that we need to make sure that the continuum stays successful. It's also really important for members of the Health Council to just be aware how the region serves those that are in crisis and the structures that support this process. We also ask that integration is a way that we can help work together. So we're having this regional planning effort. The High Desert Homes, or the 10-year plan to end homelessness, is going to be updated. We're looking for opportunities to connect this work with other strategic plans and integrate that into the community as well. And we're really hopeful that, in your respective careers or jobs that you go back to outside the Health Council, that you can help support the adoption of best practices into the work, of your employers. We're also looking for partnership. We're really hoping to embed our work in your work in the community. So looking for ways that we can partner to help folks. We really want to bolster relationships to improve collaboration, data, and the way we share resources. we want to share in the work as well. So as Lindsay had indicated, there a lot of this work is done by committee, and it's done on a volunteer basis. So we really encourage you or members of your staff or through your agencies to become HLC members and contribute to committee work if you think that it would help the region. And then finally, we do have a request for a little bit of financial support as well. So for all the work of the collaborative applicant role, we were granted about $20,000 a year through the planning grant. And that is candidly not enough to support the level of attention that the continuum needs. And so we are aware of the way that funding comes through the Health Council, and we just kind of want to prime you to maybe expect some requests in the future through committees. And final slide, please. I want to open this up to any questions, and I want to say thank you all so much for being here and for your continued support of housing and houseless efforts here in Central Oregon.
Thank you, Chris. And do we have Cheyenne? Do you want to note Cheyenne's role in the collaborative office's role as well, please?
Hi there, this is Cheyenne. Can you hear me?
Yes.
Hi. Well, I think I've met some of you in the room and virtually. For those that I haven't, I'm sure I'll make my way to meet you. I am the new incoming executive director or director of the Coordinated Houseless Response Office, which is, I think, a complicated way of saying that I am here to support all of the excellent efforts that are already underway. I've been very impressed with everyone that I've met. I've done some site tours, some street outreach, some ride-alongs, and I can just see how much work is happening in this space. The goal of this role is, first of all, evolving. I'm sure that it will continue to evolve over the next couple of months and ongoing. But ideally, it is intended to not duplicate any of the programmatic work that we're already doing, but truly support it in terms of investments around technical assistance and capacity building, obviously coordination, just connecting the dots between resources, and really trying to reduce some of the red tape and barriers that we see within the system so that we can help improve the lives of vulnerable folks experiencing unsheltered houselessness, which we know is so high in this community, as well as bring in some more resources and advocate for those funding channels at the state and federal level. So if we have not already connected, please do reach out to me. I will provide my email and cell phone number so that you can connect with me directly. I'm working closely with a lot of your agencies, but happy to have one-on-one direct conversations. It's very helpful for me in building context in this community. And so if you have any specific questions for me right now, I'm happy to answer them. Otherwise, I'm sure we'll connect in the coming weeks.
Thank you, Cheyenne. Thank you, Chris. So I'll turn it back over to you, Chris.
Yeah, I just wanted to create an opportunity for folks that might have any questions. It's really our goal today to provide as clear of a picture of, who has responsibilities and what they are. And so if there's anything else we can do to provide clarity, we'd be happy to.
Hey, Chris, Dan Stevens, can you hear me?
Yes, we can. Thanks, Dan.
Awesome. We could hear you really well, by the way, all three or four of you. Thanks. Super impressive. I know it just feels like there's a kind of another level of coordination going on, and then a recognition that we're really only going to be successful if we're highly coordinated. If that is the case, help us. I don't know that I could sort through it when you talk about the 10-year plan and then you talk about the path to zero and some of the other things. Is there one overarching frame or strategic plan, if you will, can forgive that term, but is there kind of a one plan that binds them all? And if so, which one is it?
Yeah, that's a fantastic question, and I'm going to take a stab at it and then pass it along to folks that are more knowledgeable than I. I do believe that the 10-year plan to end homelessness would be this big regional overarching document. I think that some very reasonable critiques of that document currently is that it's been quite a while since it's been updated. And so other strategic plans that have been completed more recently are probably more aligned with the strategies that we're actually implementing right now. And so that's really one of the reasons why there's so much interest behind updating it, and so that we can get folks realigned and kind of clear up a little bit of that confusion about like what the guiding document is. And Lindsay, Molly, Scott, does anybody have anything to add?
Yeah, really good question. And I think something that we are all concerned about, right? We want to use our resources in a really smart way, and we want to reduce duplication where possible. And we've seen tremendous service provider sort of investment and growth thanks to state and federal funding efforts, largely from the pandemic, as well as the work of Oregon Community Foundation to, leverage turnkey funds, et cetera. So we're primed for an opportunity, and part of why we delayed updating the 10-year plan was there was a pandemic. And so I think we're all a little busy, but also because we knew we needed to get some of these resources to like settle a little bit so we could get the true landscape and invest in our data so that our strategies can be data driven. So the framework for Built for Zero has been incredibly helpful to get us higher data quality across the continuum, which is going to allow us to set population specific goals that I think will be really well served and allow other providers to know where exactly they can plug in. When I think about the context of the many health providers in the room, we see the absence of housing impacting our patients every day. And we see that cross-sector collaboration and participation is certainly something that we're paying attention to at the state level, right? We started this meeting by talking about the Oregon 115 waiver. Super exciting. That's going to further influence resources for things like rental assistance or continuity of OHP. That's all really wonderful too. And we need to be on the same page about how we're going to work together. So I can't wait for this 10-year plan update to come. And I really hope that those of you in this room can assign delegates to help inform the healthcare section of that plan, because there's no way that we can write a plan without considering that. The criminal justice system needs to be involved, the healthcare sector, the education sector, those are all really important. So we're going to have population specific goals, but I think we should also probably develop sector specific opportunities. That's what I would like to see personally. And so I'm going to use this chance to kind of telegraph that to you all. Thanks for the question. And I hope that helped. Are there other questions?
I think I just, the only other thing is I just want to reiterate the importance, I think this was highlighted earlier, for education across the community in general, because so many of these initiatives just get such a backlash from common folks. So, while we can bring in some of this work in certain coalitions, just the public awareness, and I don't know what, whether those just kind of spawn a need by need. I've been involved with some of this work, but just the not in my backyard mentality is just really strong. And that's a huge barrier also. Just wanted to call that out.
Yeah, thank you for saying that, Dr. Sharma. I think that's where also capacity has been a challenge. Most of our service provider entities don't have PR teams, right? So we're really excited to cooperate with the coordinated office. We saw some great advancements come out of the Emergency Homelessness Task Force that Deschutes County, the city of Bend convened, and they developed a website that's specific to Deschutes County that can provide some education. But I think you're right, collectively centering on facts, leveraging data, but also telling those human stories like you saw from Mountain View Community Development earlier today is an important part of this work. And when service providers are sort of busting a move on the ground to help their patients, their clients, they're not focused on that other stuff, which is an important part of having a really successful response and a community that's aligned towards solutions. And I think that's where the Homeless Leadership Coalition has wanted to focus conversation is we can't do this work alone. And we really want to stay solutions focused because these are individuals and families that need our support, and they are truly our neighbors.
And Dr. Sharma, this is Cheyenne. I would just chime in and sort of reiterate what was mentioned, that, part of the goal of our office and goal and role of our office will be to produce not just one campaign around community education and engagement, but truly a toolkit of resources that consolidate the best practices that we've already seen in the community around engagement. You heard some of that from Rick Russell and Mountain View Church, but there's certainly a lot of folks out there, doing this messaging in really impactful ways. I think, Lindsay mentioned this, combining data and personal stories is a very effective format for communicating the impact of the work that we're doing. But also, truly a toolkit that can be utilized by the range of service providers and policymakers that are, advocating for more solutions. I think a flexible toolkit that you can kind of pick and choose what's going to be helpful in the conversations you're having with the community will be part of the work that we are happy to support and, produce materials around, consolidate materials that exist. So I'm happy to, have my door open for those conversations and see what would be helpful to you and your teams.
Great, thank you.
Wonderful. Other questions? Anyone in the room? Okay. Well, in true Central Oregon fashion, I think what we just had a presentation about is a lot of collaboration and really important making sure that everyone understands who's doing what and that there isn't duplication in the system. It's actually fairly well aligned. It's just really needing to be able to solidify some of those efforts. And one of the pieces that's been mentioned a lot is the planning document and the planning effort and keeping that alive. And so as the region's council of governments, we intend to keep a work plan and be able to guide forward what that looks like. Most important, I think, it makes sure that we are filling the gaps and needs that our community currently has when we have funding that's available. And the planning effort that we intend to embark upon is one that takes into account community uniqueness. And so a Metolius or a Madras or a Lapine does not look the same as a Bend or a Redmond or a Sisters or Prineville. And so that is inherent in those planning efforts. And so for those that are wondering, will it just be a large encompassing, of course, every solution, everyone needs housing and there is a solution. It's everything from behavioral health supports, detox supports, all parts of the system. So Chris, is there anything else that you would want to say?
I just wanted to thank all the partners that we've worked with along the way. Neighbor Impact has been instrumental in this transition and helping make sure that COIC is up to snuff and making sure that the continuum is well supported in the transition. I also want to thank Lindsay and Mosaic co-chair, and also Eliza Wilson, the chair of the HLC. And I also want to extend a thank you to Cheyenne, Mickey, and the Health Council for having us here today. So thank you all so much for your continued partnership. And we look forward to coming back and letting you know the results of all this powerful work that we're doing. So thank you so much.
Excellent, Chris. Thank you. I think I'm going to turn it over to Carmen.
Okay, great. Well, it sounds like there's amazing collaboration, as what Tammy was saying. What I did pick up from that space was that there is a need in terms of putting a regional plan together for housing, primarily so that we can actually access HUD funding. And so I think that that is an action item that we can take and move some actions around that. I don't think we're ready for a vote today, but I think that there could possibly be a task force that works on that and puts a proposal together to move that forward.
Carmen, that would be great. And I would ask Chris, I know that we want to honor the committee structure that we have at the Health Council. This is a fairly, I wouldn't say unique, but it is it's not necessarily a project. It's a regional, effort. So let us work with probably Gwen and Michaela and have an opportunity to kind of figure out what that looks like, and we'll bring it back to the council. Does that work for you, Carmen?
That's the perfect route, the way that it needs to go through. Thank you.
Okay.
Okay. Oh, Brad has a question.
Oh, great.
Hey there. Hey, I met with some folks here at Latino Community Association. We met with Erlene Taylor, who's running for a city council position, the current candidate, and she happens to be a property manager, own a property management company. And I brought up the question with her, and I think I brought it up in the past with the Health Council, but if not, now's the time. That I'm very concerned about the fact that the moratorium on evictions just sunsetted on the 30th of September, I believe. And I'm just wondering if anybody in the folks, I guess they're all folks who just spoke or anybody else working in
Oh, they're coming back in.
housing is monitoring evictions. And the thing that Arlene brought up was that she was going to ask an attorney because eviction notices have to go through the court. And so that's kind of like the place, I guess, where the data lives. So I'll just pass that on because I'm very concerned.
Yeah, I think we should be very concerned. The eviction moratorium ended on September 30th. Statewide, there is funding through Legal Aid Services of Oregon to increase capacity at legal aid offices across the state. We have a dedicated attorney in our local office. Anecdotally, the HLC has just like an info@ email address, and we have received significantly more inquiries since September than we typically do to direct towards rental assistance. We do have some agencies that have limited rental assistance funds available, but evictions are imminent and there are many lawful reasons for eviction, which is part of the problem, and certainly not enough places to move people into. So I do think we're about to see quite a cascade of folks who are going to be vulnerable in a way that they've never been vulnerable before. And we do not have sufficient shelter beds or alternatives, nor do we have sufficient rental assistance. Molly stepped into the room. So Molly, would you like to say anything around the volume that you've seen at Neighbor Impact?
So we are currently processing the Oregon Eviction Diversion Assistance Program. We're wrapping up from the kind of extraneous applications that weren't served through the Oregon Emergency Rental Assistance Program prior to that. We are not seeing a whole lot of court eviction summons come through. We've spent approximately over the course of the last 2 years about $20 million in rental assistance. So we're seeing some people coming in just needing an additional support for the month or ongoing for a month or two. But one of the things that we think is going to happen, and certainly is a concern, much along the lines of what Brad mentioned, is that what we've created with some of the rent relief funding through the pandemic is we've created basically a stay on a significant highlight around rent prices across Central Oregon. And we are going to see so many households that once their assistance runs out, if we've paid through November, or the OERAP program through Oregon Housing Community Services has paid through November, we're going to see folks that no longer can afford to live in Central Oregon. There's not anticipated additional funding coming through the Community Action Agency disbursement from Oregon Housing Community Services that we're aware of yet. And we're at the tail end of our funding. So yes, it's a huge concern. I don't think there's been a massive uptick in actual evictions. At least they're not coming through us. But it's going to be highlighted that our folks on fixed incomes and that are housing burdened already prior to the pandemic are going to be priced out of the market. There doesn't appear to be a great solution on the table in any way, shape, or form. I know it's a hot topic at the next legislative session, but at the moment, that's really all that we know. So not much help, but a little more insight that we've created some dependency with those supports. And it just highlights the need for those ongoing supports.
Chair, if I may, I have something to add as well.
Please go right ahead.
Okay. There are two Band-Aids I can offer in this space as well. I just want to send a reminder out that 5% of the quality improvement metric dollars earned in Central Oregon went towards quality improvements. The provider engagement panel identified 2 places to spend those dollars, and both can be helpful in this space. The first space was north of $500,000 was provided to Thrive to help families and individuals connect with resources in stressful times just like this. It is individual member support. So if you hear these things, and you can share within your communities to help direct people to Thrive. The other good news I have to share is the other side of those provider engagement approval funds went to Pacific Source for flexible services, and those flexible service dollars budget is identified also for member non-covered medical expenses. So when we think about a behavioral health or a mental health crisis, we think about somebody who's trying to discharge from the hospital. We think about someone who has had a wound surgery, who needs temporary housing, who is otherwise houseless. Just letting a lot of the community in this room works through flexible is familiar with that. We are not out of funds. We are sitting somewhere north of $100,000 through the year. So these are not permanent solutions by any means, but here are a couple Band-Aids to help in light of Brad's great concern that he put forward.
Thank you, Tricia. Thanks, everyone. Okay, Tammy, thank you, everyone, for your support during this time.
Was that what the board is hoping to learn in terms of who's on first? Is there more that you'd like us to bring back? Are there questions that remain in the space of how are we coordinated in addressing the public health crisis, which happens to include housing? I know this is one part of it, but an important piece, because individuals who are, of course, unhoused, there's housing insecurity, and then there's being able to stay in the housing. But that first initial piece, I think this is sort of that basic part. Are we getting you what you need? If not, I guess I would turn it the other way. If not, please let Carmen and myself know, because we will continue to bring back additional efforts and opportunities to learn, and so that we can all know who's doing what in the community. And maybe there isn't someone who's addressing the need that you see. I'll maybe pause there. Okay. All right. Well, we will move on to the next topic. So we have Janice Garceau with us today. She is going to be, oh, wonderful. Hi, Janice. It's fun. It's like being on a tour. So Janice is the newly appointed Health Services Director for Deschutes County. Congratulations on your new appointment. And we are going to be having an update in reference to the conversation, which was the other public health crisis, and that's community violence. And so Janice, thank you for being with us today. I'm going to turn it over to you.
Okay, thanks. This is an interesting presentation format. The laptop in my lap. It really is a laptop. Good to see everyone either in the room or on the screen. I did bring a few brief slides, and I can't totally see them because of the way the screen is loaded. It's okay. I brought handouts for myself. So I was asked by Carmen to come and talk with all of you about violence in the community from a mental health perspective. Thank you, Carmen. And I didn't have a whole lot of information about what exactly people wanted to hear. So I tried to provide a little bit of information about just what we know factually about the links between mental illness, substance use disorders, and violence, and then talk a little bit about what we provide to individuals and make space for questions. So the information here is really a summary of literature, and it is taken directly from the literature. So I'm going to just cover it as talking points and pause for a moment after that, and then talk about what Deschutes County Health Services provides. So what we know about the link between mental illness and violence is that most individuals with serious mental illness are not, in fact, dangerous. We know that most acts of violence are committed by individuals who are not mentally ill. We know that individuals with serious mental illness, in fact, are victimized by violent acts more often than they commit violent acts as compared to the general population. Being a young male or a substance abuser using alcohol or drugs is a greater risk factor for violent behavior than being mentally ill. And no evidence suggests that people with serious mental illness receiving effective treatment are more dangerous than individuals in the general population. That said, there is a small number of individuals with serious mental illness who have more, can represent greater risk for acts of violence, especially if they are not actively engaged in treatment and are actively abusing substances that have a disinhibiting effect. Can you go to the next slide, Michaela? So what else do we know? Again, there's limited evidence that mental health problems are an independent predictor of violence when accounting for other factors such as substance use or previous violence. Only a few serious mental health conditions, particularly schizophrenia, and especially schizophrenia with high rates of command hallucinations and paranoia, as well as some cases of bipolar disorder, are consistently linked with violence. But substance use is a robust predictor of violence and often substantially reduces the association between schizophrenia and bipolar disorder. And that's just a sort of fancy research way of saying when you include looking at the predictive or the related factors of substance use disorders, that's actually more predictive of violence than the simple presence of a mental health condition. It is rare that someone with mental illness commits street violence. Most violence committed by people with mental illness, like much violence in our country, is actually directed towards known persons, family members, friends, etc. And they are comparatively much less of a threat to the general public safety than other individuals who commit violent acts and are not mentally ill. Most mentally ill individuals who have access to a gun have acquired their gun before signs of a mental health problem became evident. And for that reason, often the efforts that are put in place to detect or use mental health conditions as a way to prevent gun ownership sometimes have not been as effective in terms of background checks. And mentally ill individuals, again, are much more at risk for interpersonal violence, meaning suicide or death by suicide, than as interpersonal, than violence directed to other persons. And there is considerable evidence that stricter gun laws or processes in the law that allow the removal of access to weapons for people with suicide risk can have an impact on decreasing rates of suicide. So these two slides really are summarizing some of the recent literature reviews that look at the link between mental illness and substance use. I will share both of those articles with you, as well as an additional one if people are interested. I can send it to Michaela to distribute to the group. So this is just a summary of what we know at this time. Can you go to the next slide? So what is the current state? And this is epidemiological data that was generated by one of our epidemiology staff internally to health services, and based on vital record death certificate information that's current through August. So just a caveat on the data. What we know is that Oregon homicide rates have risen and fallen with the national trend. 2020 was a particularly rough year, 2021 as well. We are on track this year, if I can use such a mundane term for something as serious as homicide data, to have lower incidences of homicide statewide. In Deschutes County, homicide rates have been very, very low. 3 in 2017, and you see the numbers there on your screen. In 2022, we had 8 homicides through August. So one of the things that I really want to offer as a caveat when we look at data like this is it would be very easy to say something dramatic like there's been a doubling of the rate. But when you're looking at rates as low as 3, 5, 8, we just need to be really careful about the meaning we make of that data. The reason, as you all know, if you've read the news, that we have a significantly higher number this year is because 2 of the homicide events recently involved, in one instance, a double homicide, and in another instance, a mass shooting. We also track, as you know very well, death by suicide, and data does show actually a much stronger link between mental health conditions and the loss of life to suicide. patterns in the US show that folks who die by suicide have at least some in 35% of the cases had a current depressed mood, 50% had a current mental health problem, and 27% were receiving current mental health treatment, which is a really interesting statistic, because what it also tells us is that when people are not actively involved in treatment, that risk really goes up. Additionally, we still see the link to alcohol and substance use. In Deschutes County, we have 1 year of data where there were a fairly significant number of losses of life to suicide. And since that time, the rates have remained relatively stable. There is a slight uptick in 2021, and this year we're looking more like other years, although the year is not over. And again, with these figures, any loss of life, we don't want to minimize loss of life, but it is important to look at the actual factual trend data when we're thinking about violence in our community. Next slide. I actually, can you back up one? I just want to pause here and see if there are any questions just in terms of data before moving into services. It's heavy. Yeah, it is heavy. Okay, next slide. So what is your local community mental health program doing to address violence in the community? We provide treatment services, many of which have a direct impact, we hope, on reducing the risk of both self-directed violence and violence directed at others. The folks who work in our Deschutes County Stabilization Center, our intensive forensic services teams, our forensic diversion team, our other intensive offerings, all are individuals who routinely engage with people who may have some history of risk or some of the risk factors for self-harm or for harm of others. We provide training to staff routinely around suicide risk assessment around harm to others, and management practices that are evidence-based related to managing both suicide risk and risk of aggression. We have a protocol internally that we refer to as a high-risk huddle. So if we're encountering an individual in the community or in services that we think we're concerned about, that we think may have some real risk markers for harming others, we are able to huddle in less than 24 hours with our medical director, our operations folks, law enforcement if need be, our clinical staff, and make a plan to mitigate risk. We are active partners with our school system around the student threat assessment system collaboration, which is a regular opportunity for schools to identify students that have made threats or that they're worried about, and we participate in the assessment process with those individuals. We also conduct internally what's called an adverse outcome multidisciplinary care review, or case review. That's a typo, sorry. And that case review we do typically 2 months after an adverse incident on purpose. That's part of the evidence-based protocol for this kind of debriefing of a case, where we work with the treatment team and external providers if they were involved, even including law enforcement or hospital staff, to look at what we did well and what we missed in working with a particular individual. And that's a way to improve practice and to have safe spaces, to have clinically meaningful conversations about what we need to be doing better when we're managing high-risk individuals. We're also the local provider of critical incident stress management debriefs. So this is a model of evidence-based debriefing that occurs sometime between 24 hours and up to a week after a critical incident in which there was violence or a loss of life. It is intended to help people who were impacted in any way mitigate the harm that can come from being even indirectly connected to an adverse event or a loss of life. I think you all know that in the most recent event in our community where there was a shooting, we were able to stand up a CISM response broadly to the community. We provided that individually to some folks who were directly involved, and have continued actually to provide some follow-up services to some of the individuals we encountered. And then as a health services agency, we also have a suicide postvention responsibility and an emergency preparedness role in providing responses to the community after loss of life. Next slide. This just points you to the research that's referenced in this presentation, and I'll be sharing that with folks after the meeting. So I'm going to stop here and I'm going to put the camera back on so I can see people. Okay.
Janice, thank you very much for that overview. And thank you for just leading the community in times of really tragic events. And I know that you work closely with the other communities of Jefferson and Crook as well. And so the system itself of whether that's a crisis team, the support of each other is really strong. And that isn't the same way in all of the communities across Oregon. And so I just wanted to say thank you for your personal commitment of making sure that that continues to happen. What do you see from a health council perspective that we maybe are not aware of, or maybe there isn't something, but is there anything else that you want us to know in terms of community violence as it sits with, in particular, gun violence? Is there something else that you feel like is not being addressed in the community that should be top of mind for us?
I don't know if it's not being addressed. So I would say two things from my perspective are really critical. One is all of you can really carry the message that having a mental illness in and of itself does not make someone more likely to commit violence. And that is, it's just critical because of course, the worst case scenarios are the stories that people see and hear, and they're tragic and they're horrifying. And there's a tendency to generalize from that. And that can really do harm to many of our clients who are really vulnerable and more likely to be victims of violence than to perpetrate violence. So one thing you can do is please carry that message, please carry that water for our vulnerable populations. The other thing I would say is making people aware of gun safety and I'm losing the legal term, but there are laws on the books now in Oregon that allow a family member who's worried about loss of life to suicide to request that guns be removed temporarily. And we know, no matter how people feel about guns in the community, we absolutely know that if someone is depressed and there's a gun present and there isn't a safe protocol for managing that lethal weapon, the risk of loss of life goes up astronomically. So guns are part of our community. They're part of the culture. There are uses of guns that are absolutely understandable and part of a way of life. And there are moments when loved ones really can take action and should take action to just remove that unalterable way a person can end their lives in a moment of impulsive despair. And we know for our young males in particular that death by suicide can be an incredibly impulsive event and can come with very little warning. So paying attention to that and being proactive quickly is important.
Excellent, thank you. And it makes me think of the destigmatizing, oh, I can't say it, destigmatizing. We were talking about it in terms of individuals who are unhoused and individuals, that are struggling in our community, having the Health Council be able to be champions for those that a narrative has been created that isn't necessarily accurate. And so how can we use our bully pulpits in areas in which we have an opportunity to share with the community what the reality is and what the facts are? And so thank you for raising that as well, Janice. Yeah. Any questions or comments? Okay, well, congratulations again, Janice, on your new position. Yes. Super excited to have you in that role and look forward to having your involvement in the Health Council too. So hope to see you more often.
Yeah, thank you so much for your attention, and I'm glad that you all are talking about this subject.
Yes.
I'll hand it back to Carmen.
Wonderful.
Great, thank you, Janice. I know that this is a really important issue here in our community, and we feel really good that there are things that are happening here, everyone's being taken care of. So I guess we can move to our last but not least announcements. Are we ready to do this, Tammy?
Yes, Carmen, go right ahead.
Okay, great. Well, we kind of knew that that was going to be a heavy topic, so we wanted to end our board meeting with several highlights and good news of some things that are happening. And Lori, if you want to come back here with me, one of the first announcements, and this is in the ED report, is that COPA, Central Oregon Pediatric Associates, will now be doing oral health assessments and fluoride application for all well child checks for children 6 months to 14 years old. This is definitely an integration model where Dr. Logan Clausen and Lori Hill are successfully building this into their process. So training is currently in place with a launch hopefully before the end of the year. Yeah.
Hi, everybody. I hope you can hear me okay. I'm Lori Hill. I'm the CEO at Central Oregon Pediatric Associates, and thank you, Carmen. We're very excited to be able to offer dental assessments and also fluoride applications in our clinics. The training started a couple of weeks ago, so we aren't going to be offering it till probably the end of this month. We'll definitely have it in place before the end of this year. We know there's some catch up to do in the community. So we're working hard on getting everyone trained so that we'll be able to, as I said, we're pretty sure end of the month, we'll be able to start offering this opportunity to all of our kiddos and their families. So thank you.
Thank you. So that is an awesome model of what integration looks like, and we're hoping to see more of that down the road. Second bullet point and announcement is the Oral Health Work Group, which is an active group, will now be merging with the Regional Health Improvement Plan Dental Work Group to remove redundancy and continue to have support from COHC on funded projects. And also the Pain Standards Task Force has grown up and will now be sunsetting its program from Central Oregon Health Council. It's really done a lot of work, and we'll probably be putting together a newsletter and story around that, and really institutionalizing it into the Overdose Prevention and Crisis Response Task Force. So actually, I think it's a coalition now, and it will actually continue to do its work in a broader coalition with subject matter experts across the region. And last but not least, I got an email from Justin that their group over in Summit received and was recognized as a 10 Gold Star Epic user. So I just thought that I would mention that because I think that that is definitely a designation to recognize. Some new changes happening at COHC is we have new staff. Miguel Herrada, are you there? Do you want to come back here and say hi to everybody? Even though you're actually in the physical room. Okay.
So, yeah, hello, everybody. Miguel Angel Herrada. We have had the opportunity to see us in the past when I was working for Pacific Source. So very happy to join the Health Council team now. Thank you for the welcome.
Thank you.
We're thrilled to have you.
Yes.
And thank you, Dan. Thank you, Pacific Source team.
I think we're even now, right, Dan? Like we talked
So
about.
he's
Okay.
he's just so good. I'm just smiling.
That's great.
I think we are even.
Well, we had that good news, but we do have some sad news. Renee Worth is no longer with the Central Oregon Health Council, and she is pursuing her dream of having a doctorate in public health. Did I get that right? Okay, and so we're really excited for her, and we want to recognize a lot of the work that she's done these last 2 years. It's been really challenging these last 2 years. She came on during the pandemic, and I think it's important to recognize those that have really kind of stuck it through. But we're excited for her because this just means growth. And last but not least, so I don't start crying. I'm so bad at this. Rebecca Berry is also leaving the Central Oregon Health Council. She has been with Central Oregon Health Council for over 8 years or close to it. The work that she has done for the council is phenomenal. She did the regional health assessments twice, I believe. She really uplifted our grant platform and all of the amazing relationships she's created for Central Oregon Health Council. So she's actually back here with me with the childcare room, but I'm gonna present her this. We bought her some flowers. So please, everyone, shower her with more flowers, but I'm gonna give the mic to her. You wanna sit here?
Hi, everyone. I just want to express my deepest gratitude for you all giving me a chance 8 years ago and hiring me as your first project manager and launching Pain Standards Task Force. The opportunities that I have received at the Central Oregon Health Council are innumerable, and the growth that I've experienced and the relationships that I have had the luxury of building and growing words cannot express the gratitude that I have for all the opportunities that I've received here, and I'm so incredibly grateful, and I hope that I will make you all proud and continue my work in building relationships and partnerships at the Roundhouse Foundation, launching their first initiative of 6, and this is specific around rural access to healthcare. So I will be getting in touch with all of you and continuing to bother you. And again, I feel so incredibly fortunate to have met you all and have had the opportunity to learn so much from each of you. Thank you.
Well, Rebecca, we simply would not be where we are without you. We're going to be hard pressed to find a person with a more analytical and creative. I mean, the uniqueness of what happens in your brain is just not replicated. And you've created a foundation for us to stand on that has integrity of our process. It has integrity of using the data to be able to know that what we're doing matters and we're tracking the right things, and that we're, reaching out to the right parts of our community. And I mean, just who you are as a human it's been my honor to get to know you, but to be able to work with you and be able to learn from you has been a gift that, I will cherish. And Erin is so fortunate to have you on the team. And so we know who's buying drinks next. And just want to say thank you for the commitment and the dedication and the passion that you've put forward for the region, and the support and the guidance that you've given to the Health Council to get us where we are as a region and as a group. So I'm grateful to you.
Thank you.
Yes. Okay, well, there's some love in the chat room too. So Carmen, go ahead, I'll turn it over to you.
Yeah, I think this is a good, happy way to end, bittersweet. But the good news is that Rebecca will still be in the region. And so everyone get in line for your biking and hiking trips with her.
Okay, so do we have other announcements or things that we want to put? There's more love being shared in the chat room for Rebecca too. So we'll want to be sure and share that with her.
Absolutely.
Okay. So if there isn't anything else to come before the council, I think we are adjourned. And Carmen, I'm committed to helping you with the IT stuff so that we can figure out a way to make this better. So it looks like we lost Divya, and she was saying goodbye. Okay. I thought she had her hand up.
Okay, well, thank you all for your patience, for sure.
Okay, bye.